Now, if you have to go to the pharmacy to get any kind of drugs, you know that if you didn't have insurance of some kind, it would be an absolute financial disaster. Believe it or not, and you may be one of these people, you may not have insurance, and then it is an absolute financial disaster for you. So yesterday, CEOs from companies like Pfizer and Merck, AstraZeneca, there were several other companies that were there, Bristol-Myers Squibb, Johnson & Johnson, they appeared before the Senate. There was a Senate hearing yesterday that was presided over by Chuck Grassley. You remember Grassley from also his time on the Senate Judiciary Committee and the Brett Kavanaugh hearings. But he also sits on this committee as well. And also among those that are on this committee, and this is only in Washington, are people that actually take money from Big Pharma. And so the stench of Washington can be smelled all the way out here in the greater Cincinnati area. But I wanted to get to the bottom of this somehow, some way, as to why all of this is going on and what the answer is. It can't be all insurance, can it? It has to be some big pharma, can't it? It has to be the people that we send to Washington, D.C., right? Seth Denson is a healthcare expert, and we've had Seth on before, and he kind of makes sense out of all of this stuff, and I'm glad that he's going to join us here on 700 WLW right now. Seth, good morning. Thanks so much for joining us.
Ken, good to be back with you.
I'm watching, I went home and I'm watching the coverage of this, and I wanted to scream because nobody wants to say it's our fault. The Pauls are taking money from Big Pharma. Big Pharma is saying, no, it's insurance's fault. Insurance is saying, no, it's Big Pharma's fault. Meanwhile, we're sitting out here wondering how we're going to buy our next aspirin. Where are we on this thing?
Man, you're hitting the nail on the head, and you talked about the stench up there. It was just as smelly down here in Texas where I am. I was watching this, and I'm going, boy, what a show this is. And there are a couple of key things that I took away from this. Is one, just exactly the point you mentioned just a minute ago. On the committee yesterday, there was $2 million worth of contributions from Big Pharma to the various senators on that committee. And so here's the thing. I'm not going to defend Big Pharma. You know me, Ken. But here's the thing. Those guys, they're playing by the rules that the U.S. government and the legislature has put in place. If the U.S. government wants to get serious about changing the way that prescription drugs are bought and sold and priced in the United States, it needs to restructure the way that the game is played. Now, I'm not saying regulate, and I'm not saying take over. I'm saying just restructure some basic common sense ways in which the U.S. government is allowing for a lack of free market competition when it comes to prescription drugs.
Well, okay, and herein lies the rub. These companies that make these prescriptions, they want to be reimbursed and they want to be protected, not reimbursed, but protected for all of the research and development that went into making that drug. But some of that protection extends out decades. There's got to be a moratorium on this. There has to be at some point, okay, that if that doesn't cover your R&D, make another drug, and eventually, instead of making 30% profit, maybe you're going to make 20% profit, but you'll still be in business. Why is there that long of a moratorium on these drugs?
Well, and that's part of the rub that I've got, because here's the thing. So I completely understand if you're going to invest on average $2 billion in bringing a drug to market that takes 12 years, you want to make your money back. Otherwise, we can just forget curing anything or having new drugs come out. Nobody would want to be in business to do it. But here's the thing. The pharmaceutical industry understands how the game is played, and the government plays right into its hand. In the years between 2005 and 2015, of the top 100 best-selling drugs, 80% had at least one patent extension. So there's a 20-year patent on a new drug, which means that drug manufacturer has to get their money back inside of that 20 years before new competition can come to market. Well, the pharmaceutical companies have found ways to file for patent extensions. That's doing things like changing the molecular structure of one part. Humira, which is made by AbbVie, which was part of the Senate hearing yesterday, for example, They've had over 130 patents issued for that drug, one of which is how the disease responds to the drug. How do you patent that? That's just absurd. So the U.S. government issues these long-term patents with no end in sight, and these pharmaceutical companies understand how that game is played. They can squash competition by just adjusting one little thing in the drug, and now all of a sudden they get another 5, 6, in some cases 10 years.
So let's bring into the conversation, if we could for a second, insurance companies, because that's where Big Pharma wants to point the finger at, that the problem is with the insurance companies. Now, I'll be honest with you, Seth. I don't think I'm an unusual person. If I need treatment of some sort, I'll go in and I'll get it from my doctor. I'll go to a hospital. I'll go to an office visit. And you'll always see this. You'll see, well, here's what it costs. This is the bill. But we've adjusted here because we've dropped down the price, and here's what your insurance company is paying. And you probably get to a figure where, if you're lucky enough to have insurance, the treatment actually costs. I look at the drugs that are prescribed for the various ailments that I might have. And I look, well, this is what it really costs, but, we're going to adjust this over here, and then here's what your insurance paid. There's a shell game going on at some point between doctors, and they're all working for big companies anymore. There's no individual family doctor. There's a shell game going on between doctors and the big companies they work for, and big farm and hospitals. And meanwhile, we're all trying to watch that show go around that has the ball. We're dead. Where does it stop?
Ken, I'm reminded, the game you play when you're a kid, you had the 3 cups and you put the ball in one of the middle ones and you start moving the cups around and try to figure out which one will have the ball underneath it. That's what this is. And so there's a lot of talk these days about collusion. You want to talk about collusion, look at today's U.S. healthcare system. The pharmaceutical industry, the insurance industry, and the healthcare delivery system. They all like to point the finger at each other, but they're all working together. Because as long as they keep it so stinking confusing about what the real cost is, people can't get to the bottom of anything and demand change. And so here's the lovely thing about insurance companies, right? Insurance companies, well, they own the distribution, because there's a middleman called a pharmacy benefit manager that actually negotiates the pricing of the drug and then resells it to you and me at the end of the day through the retail pharmacy. The insurance companies own that. They own the PBMs. 80% of all drugs are distributed by insurance company-owned PBMs. And so the insurance company is in the background making we'll call it an under-the-table reimbursement profit because of the way the game is played. So I'm quick to point the finger at the insurance company too. So we can point fingers at the entire industry. But again, I'm going to go back to this Senate hearing was a show, and if these guys and women want to really get serious about the game and how it is played, then restructure the way in which free market operates in the United States. Free market is the solution, but it has to have competition.
Seth Denson, president, co-founder, GDP Advisors, healthcare strategist. Okay, so is that the answer, or we have to put our faith in these people we send to Washington who, basically give us a clown show for as long as they're there? Is that it? Is that they've got to have some serious altered legislation for this? Is this the only way out?
Well, I don't know about the only way, but it is the primary way. There's no easy way out of this, but that is the most constructive way that we can get through this. Listen, the U.S. consumer is partly culpable in this too. So I don't want to, say that we're not responsible, because when it comes to healthcare, we just don't ask questions. We don't do our own research. We don't do any of that. And so we need to be more engaged in this process. But listen, if our legislatures that we are sending to Washington continue to play this game, well, for goodness sake, let's send new people up there. You mentioned Chuck Grassley, for example. He's collected over $1 million in pharma money from lobbyists.
That's unbelievable. Unbelievable.
Are we really thinking that Chuck Grassley is going to solve this problem for us?
No.
We need to think differently about who we're sending to Washington and how we're asking them to make some changes.
Amen. Seth Denson, always great having you on. Thank you so much for your time here today.
Good to be with you, Ken. Thanks.